Hello everybody, my name is Rachel Notareschi. Today I'm going to be talking to you guys about kidney stones. Let's go ahead and get my PowerPoint pulled up here. All right, so what are kidney stones? Kidney stones are renal calculi. They're hard collections that form in the kidneys. They can be made of different minerals and salts. There's a couple different things that put people at risk: family history, being dehydrated, diet high in protein, sodium, and sugar, a high BMI, a lot of gastric and intestinal surgeries, irritable bowel syndrome, a lot of kidney diseases such as cystic kidney disease, renal tubular acidosis. You can have the repeated UTIs put you at risk, and the hyperparathyroidism for the calcium levels. Different medications can be your diuretics, your calcium-based acids, and some antibiotics as well. So Friends is my favorite show. There's an episode where Joey has a kidney stone, and it's the most painful thing in his life. So your most important things you're going to ask about is their pain. You're going to ask about their urinary frequency, the characteristics, the color. Ask them about any nausea and vomiting. Make sure you're ruling out any infection. Also asking them about their GI symptoms. This can rule out those potential differential diagnoses that can mimic kidney stones. So your physical examination, that's going to be a detailed abdominal exam. You're going to be listening, palpating, percussing, making sure you're looking for any hernias, bowel sounds. They're going to have that acute flank pain that's expected with the kidney stones. And then you're going to have an ultrasound or CT scan that's going to show where your stone is, how large it is. You want to make sure it's less than 6 millimeters. Your urinalysis that's going to show any red blood cells, white blood cells, infections, blood in the urine, CATs, mineral bacteria, pus. Your serum studies, that's going to show if there's been any kidney damage. You're going to be wanting to look at their BUN, their creatinine. Also, you're going to be looking at their magnesium, their calcium, and their uric acid as well. That's kind of hopefully tell you what kind of kidney stone this is. So based on all that, you have 3 different treatments. You have your watch and wait. This is with your smaller stones that will likely pass on their own within 6 weeks. You're just going to be monitoring for signs of infection, treating that pain with NSAIDs and sometimes some narcotics like Norco or Percocet. Another medication you can use is Flomax. This relaxes ureters and makes it easier for the stones to pass. And if that does not work, you have surgery. And sometimes patients will just opt for this if they feel like the pain is too intense, they've had kidney stones before, and they don't want to go through that. Or while you're watching your kidney levels, if you notice a decrease in kidney function, and that means there's probably a pretty big blockage. There's a couple different types of surgery listed below there: the shockwave lithotripsy, the uteroscopy. Your priority teaching with these patients, you make sure they drink plenty of fluids. That's going to decrease the risk of that stone formation, that crystallization to happen if the urine is not as concentrated. It's recommended for 3 liters a day. Your diet, you're going to want to have them reduce their salt and meat intake, increase certain fruits and vegetables, teach them about the medications that helps treat the stones, and then teach them about the medications that they might be on in the future to help make sure they avoid getting stones. That's going to be your Flomax, teaching about that, your NSAIDs, your thiazide diuretics, your potassium citrate, and your allopurinol. The last 3 listed below, that's going to be kind of based on what kind of kidney stone they end up having, whether calcium, uric acid based, whatever it is that they end up having. So thank you all for watching. These are my references. Have a good day.